Good morning everyone and welcome to Friday Live at the OHbaby office. So good that you could join us this morning, and a special welcome to Dr Melanie Woodfield. Hello Mel.
Hello Ellen.
Great to have you here again.
Nice to be back, thank you.
Isn't it? Now Dr Melanie is a clinical psychologist specialising in children and youth, and Mel has also written for OHbaby magazine for years and years.
Yeah, it's been a wee while.
Like nearly 10 years. So we have benefited from Melanie's wisdom for many years, and great articles of Melanie's on our website and in our magazine, so check them out. And we thought we'd just get Melanie this morning to talk about some more behaviour related issues, because let's be honest, children and behaviour is a big topic.
Absolutely.
It's a huge topic, and we had Dr Melanie in with us a while ago, a couple of months, and we got talking about tricky behaviour, and we could have talked all day.
Yes,
so we thought,
indeed.
Let's do a part 2 of this discussion. Now you can ask a question if you're interested underneath the video, and I'm going to try and follow it here on the phone, except that the password went off again, so I'm just going to pass that back to Mel subtly, and she's going to put her password in again so I can follow the video if there are any questions for Mel. But what we're going to do is just chat, because we've got so much to talk about. Yes, we do, and we wanted to talk about, especially today, some of those things that parents can find really concerning in their children's behaviour. So the big issue of what to worry about and what not to worry about, and also Dr Melanie is going to give us some advice on where to go for help if you do need some more help and advice with your children's behaviour. In fact, that's a pretty good place to start, isn't it? Do you want to tell us a little bit about what services are available in New Zealand if you're concerned about your child's behaviour and
absolutely.
what's happening there?
So, and I think this is an area that lots of people don't know a lot about, but there are really good sort of clusters of services in New Zealand. So, and I think often the best place to start is popping along to your family doctor, to your GP. Your GP can be a bit of a gateway to other services, and your GP can sit with you and put your heads together and decide which specialist service is the best way forward.
Right.
Because, for example, there are some things that you might be concerned about in relation to your child that might either come under sort of paediatric services at the hospital, or they might come under child and adolescent mental health services. And as I say, there are actually some concerns that you might have that could come under either. So the family doctor is usually a really good place to sort of talk about your concerns and decide together whether there needs to be a referral to a more specialised service or not, and if so, which service. Because people might not be aware that throughout the country, wherever you live, you have access to free infant, child, adolescent mental health services.
Right.
They're often called ICAMS.
ICAMS.
And it's an interesting acronym. So infant, child and adolescent mental health services.
Right.
And people might be thinking, what the heck is infant mental
Yes,
health?
that is a good question. What sort of support can you need for an infant? That's really interesting.
So if you're interested, you could always Google Infant Mental Health New Zealand, and there's actually an association. There's lots of information there.
Yeah.
And obviously mental health issues look different in an infant than they do in a teenager.
Sure.
You know, you're not looking necessarily at depression or psychosis in an infant.
Yeah.
Look, the difficulties are wide-ranging.
Yeah.
And oftentimes, so when we talk about infant mental health, we're talking about birth to 4, roughly. Yeah. And look, there might be concerns along the lines of a change in baby's behaviour. Used to be quite easy to settle, and is now sort of fractious and unsettled.
Right.
Baby might seem sort of stressed or overwhelmed. There might be a kind of more tantrums than there used to be. I mean, it's actually quite difficult to define, because you'll be thinking when you hear that, but a lot of that behaviour is actually quite typical and quite normal. And this is where having a discussion with your GP or your well child provider or other professionals that might already be involved, you can have a bit of a chat about whether to worry or not. Yeah. So it's actually quite hard to describe what kinds of concerns might be seen by an infant mental health service. Yeah. But just to reassure you that they are there, they do exist. Yeah. Typically these specialised services do tend to be for the moderate to severe kind of presentations. Right. And there's a whole bracket of services for mild to moderate. And again, your GP or whoever's going to refer you can help you to decide which bracket you sit within. Yeah. And if you're in that mild to moderate sort of bracket, as I say, there's a whole range of services there too.
Right, and free services for
Free
children.
Services.
So good to know.
Yeah.
We went pretty heavy really quickly,
Yes.
didn't we? Yeah.
Sorry about that, Ellie. We should have
But it's good, it's good to know what is available and for families not to struggle on their own. So definitely go to your GP or your well child provider if you have concerns about your behaviour. Because what we tend to do is talk amongst ourselves, us parents, don't we? And do you think, we can get ourselves into more stress and worry sometimes?
Absolutely, absolutely. Somebody's
cousin's, throw in a Google search
wife's thing, is, and you end up thinking, oh my goodness, that sounds exactly like my child. And the Google search, oh my goodness, don't get me started on Google searches. Honestly, that late night Google search when you've had a day of thinking, and you hop on Google and you list a couple of sort of, my child's doing this, and all of a sudden, it's the same in the medical kind of, you Google red spot, feeling dizzy, and you come up with some rare disorder that of course you don't have, but you read it and think, and it's the same in terms of psychology and kind of mental health and child development. It's like, well, chances are your child doesn't have that incredibly scary thing you've discovered on Google. And if there is concerns, there is help available. Absolutely.
So let's go back. Let's back it up a little bit then, because we went heavy really quickly. But there are everyday issues that parents struggle with, especially with behaviour. We talked a lot last time about the sort of rivalry, siblings, but also play dates when that goes bad, and fighting over toys, and children don't necessarily show empathy or understanding of that situation. And you were really reassuring there, because there's levels of development, isn't there? And kids don't necessarily develop that empathy straight away.
Yeah, so I think empathy and remorse is a really interesting one, and I work in a large child mental health service, and one of the more common sort of statements that we see in referrals coming to us is, child doesn't show empathy, or child doesn't show remorse. And, there's a sense that people are worrying that this child is developing traits of psychopathy and they're heading towards being a psychopath or something like that. Now, look, I think there's a really big difference between often what the child experiences and what they express.
Right.
So a young child might be feeling a bit bad about what they did, but they're probably feeling a whole lot of embarrassment, shame, regret, all sorts of different feelings that might get in the way of them being able to say, I'm so very sorry about that.
Yeah.
So what I'm saying is, just because they don't seem sorry or say sorry doesn't mean that they're not experiencing some remorse or empathy, I guess.
And actually, that reminds me, you wrote a whole article a couple of years ago on saying sorry and apologising, and actually, how old does a child need to be for that even to be able to do that? And it is a complex, age appropriate,
absolutely, and developing the awareness that other people have thoughts and feelings that are different to your own is actually a set of sort of cognitive processes that oftentimes doesn't develop completely until about 3 or 4.
Right.
So a 2-year-old, for example, is likely to have the idea that what they think and feel is largely similar to what other people think and feel. So it's actually really difficult for them to put themselves in somebody else's shoes. And so, we ask that age-old question as parents, don't we? How do you think that felt for such and such? How do you think Johnny felt when you did it? And
I don't know.
2-year-olds that, literally, cognitively haven't developed the ability to look at other, to put themselves in other people's shoes. Having said that, we can train up behaviour that we consider to be useful socially.
Right.
So even though the child hasn't developed that cognitive ability, we can teach them that saying sorry is an important thing to do, and saying please, and there are lots of skills that we can teach that other people in society appreciate, even if the child doesn't have a cognitive sense of why they should be sorry.
And that's, I guess, just part of that pattern of creating manners that are socially acceptable.
Exactly.
And some of them just habit, really.
Yes,
They're not necessarily... there's not necessarily a reasoning behind it for a child, it's just a habit.
It's just an important social construct that we have. And you can teach that in the same way as many other behaviours. So explain to your child in a calm time, not in the middle of the playground battle. choose a calm time and explain why it's important that we say, I'm sorry about that, I'm sorry for hurting you, and then practice it a few times, and when you see it, when you see your child saying that, really praise it in a detailed way. I love it when you said sorry.
Great.
That was a really useful thing to do. Thank you for doing that.
Yeah.
Because what we praise, we get more of.
Yes, good. And what we ignore, we get less of.
Exactly
hopefully.
Right. Exactly right.
Fingers crossed.
Yes.
Calmly ignore. So good. So we're talking with Dr Melanie Woodfield this morning on Friday Live, and Melanie is a clinical psychologist. If you have any questions you'd like to put to Mel, you can comment underneath the video, and I will hopefully see them on my little screen here, and we can talk about those. But I've got some interesting questions. I've been chatting with a friend recently about the experience of having children with, that are highly sensitive to particular things, and people are talking about this a bit at the moment, like highly sensitive children. But what if it's just a thing that your child has? Like, for example, my child had a few highly sensitive issues for them, being they like to be tucked in really tight, they liked their hair done in a special way, and those are all good and fine until it becomes a tension, until the parent doesn't get it right, and the child then sort of grabs a hold of it, and it's tricky.
Yes.
It's tricky. There are some tricky moments. I was talking with a friend whose child has real problems with fabrics next to their skin, and the different way different clothing feels on their skin. You start off with dealing with that issue in some ways, and compromising with the outfit. But it has escalated to no clothes being permissible, no clothes being wanted to be worn by this child. How do we manage to navigate that sort of situation?
Yeah, that is a tricky one. And, I have to say, occupational therapists are real specialists in sensitivities, by the way, if people are wanting more support. And the way that, with my psychology lens, the way that I see it is, we have the 5 senses. I won't list them because inevitably I'll forget them. But touch and taste, and and we tend to have preferences or aversions in relation to each of the 5 senses. So as human beings, I can't stand, I'm forever telling the kids, turn it down. I can't stand
noise,
loud, particularly at certain times. I'm sure people identify with that if you're feeling tired. So it is really common and natural to have preferences and aversions when it comes to the 5 senses.
Right.
For some children who with a particular temperamental style, they might have sort of stronger aversions or stronger preferences. And look, I think it can be really difficult when you as a parent can see that your child is distressed by something. It can be really difficult to hold the line and to set that limit. And that's where I think validation we talked a bit about last time is really relevant and important here. So what I mean by
validating
that,
the feelings that are happening.
Absolutely. Guessing at what your child is feeling, putting it out there. They'll tell you if you get it wrong. So, I can see that not having the blankets tucked in, that actually tucking you in tightly feels really nice. I get that, and I can see that. And what we're going to do is every night I will tuck you in really tightly, one time or two, whatever you decide, and this is what we're going to do. So validation is essentially not just saying, this is how we're going to do it, like it or else. Validation is saying, I get it, I understand, you're allowed to feel that way. And I've got things that I like as well, and things that I don't like. And this is how it's going to look in our family. This is how we're going to deal with it. And then when it comes to because of course it's, if only it was that simple.
The nudity issue is a big one.
It's not that simple, but essentially the parenting strategies that you'll need to draw on are not that different from kind of setting limits in other areas of life and other domains. But I'd add in a whole lot of extra validation to acknowledge the distress that your child's feeling.
And interestingly, my friend and I were putting on our psychology hats, which are non-existent, let's be honest, but we were just sort of drawing on any sort of experience or wisdom we could come up with. Do you think, this is what we were thinking about, do you think that some of those behaviours and that the child is exhibiting, like they're just determined to not wear any clothes at home or to have a complete meltdown about how their hair is done, do you think that is reflecting other things that are going on, perhaps? Like
oh my goodness,
the attention. I know, right? I think I only came up with this because of reading Dr Melanie's articles.
Oh, we're too kind.
The attention that the parent and child are having as part of their day, and some days that is compromised, shall we say. There's just not enough focused attention. Could that be an issue, do you think?
Yeah, and I think that the two of you have done very well, obviously. But, I think last time we talked a little bit about how every behaviour has a function in the environment.
Yes, good.
Technical phrase that essentially means that your child saying, I don't want this today, or I can't do this today, might have a deeper purpose or a deeper function. So it can be really useful to ask yourself, what need is going unmet here? Yeah. Or what question is my child asking me underneath that?
Yes, right.
So maybe it's been a frantic day and there hasn't been the opportunity to connect in the way that you normally would. Yeah. And your child's attempts at bedtime to kind of insist, I want to be tucked in 50 times tonight. Yeah. Maybe there's a deeper need for connection in that moment, and maybe there's another way that your child can be supported to express that. Good. And it takes time. But, wouldn't it be ever so helpful if your child could be supported to develop the skill to say, I'm not feeling great, I need a hug, I need you to please do this and then I'll feel better. I mean, blimey, most kids can't, they're not capable of that in young childhood. But I guess just an encouragement to think about the day, look at the behaviour in the context of the day or the week or the month, and how much stress has been happening or what's been going on. Think to yourself, is there a deeper question or a deeper need that's underneath what my child's asking or insisting on? And then try to meet that need and see if the insisting on decreases.
Good. So so with this, just sort of to recap a bit, these sensitivity issues and the tricky behaviour that can result, you're encouraging us to set some boundaries that are acceptable for your own family, and they're different, aren't they, depending on the family.
Absolutely.
There's no one size fits all. If you're, I think someone said to me, if you're comfortable redoing the hair 10 times until it's perfect, then that's okay for you. But realistically, for my day, that's not, that we don't have time for that. So we have to establish how many times we will do the ponytail correctly, and then set the boundary and gently move on. But which also look at what else is happening underneath. And I've found, and I read this recently, that starting the day with that focus, connection time, some attention, really connected attention is really helpful for children.
Absolutely. And that, if I can...
let's talk about that.
Permission to rant.
Because mornings, let's talk about mornings, they're so frantic and busy. And how does that affect our children? Well... Not to make us feel bad, but to empower us to do the mornings better.
Mornings are really busy. But I guess just coming back to that focused time, you might be interested to know that
I am
many...
very interested.
Many of the really solid packages of interventions that are offered in some of these specialised services, when I think about the really commonly used interventions for young childhood, almost all of them have a component that is around having dedicated focused time with your child each day. Right. Now, we're not talking about half an hour a day per child. If you've got 5 kids, you'll be thinking, well, how do I get anything else done? I'm talking about intentional bursts, short bursts of kind of effortfully being present with your child. And I mean, we could talk in lots of detail about what you could say and what you could do. Maybe we could do that another time. Or but just making a real concerted effort with each child to have whatever you want to call it, special time, mummy, daughter time. And I'm not necessarily talking about going out for a hot chocolate.
It doesn't have to be expensive.
No, I'm talking about joining your child with something they're interested in, letting them take the lead, and just playing along and commenting on, oh, isn't that interesting? I love how you've done that. Oh, what a great idea. You're such a clever kid. I love it. Just lots of praise, and essentially having them be in the lead. And I'm talking about 5 minutes per child per day. So just putting your phone down, joining. It's ironic because I think mine's locked again.
It's locked. I was going to say, I was subtly just trying to pass that to Mel so she can unlock it. So just in case anyone's asked us a question, as the technology has been failing us a bit lately. But anyway, carry on. Thank you.
So putting the phone to one side, and you might choose to do that in the morning if you've got time, if you're a super organised eager beaver who's, you know, twiddling your thumbs too early for daycare, or you might choose to do it after daycare, after kindy, or at night. Just that dedicated burst, and you won't see necessarily immediate results, but I guarantee if you can do a dedicated burst of child-led play time, no phones, nothing else, no distractions, after a week or two, you notice a massive difference. It's really powerful.
And I think that is so key and so helpful. It's child-led, because I think can make us panic a bit. Oh, that's something else I've got to figure out in my day. But if we just sit back and let the child lead and see what they want to do with the time. And in 5 minutes, it doesn't sound very long at all, but you're saying that 5 minutes is long enough to have an impact.
The research has shown it's long enough. I'm thinking in my mind of 2 or 3 programs, as I say, that we deliver in specialist services. And as I say, this is a really core feature of the intervention, is supporting parents with kind of, what do you say, what do you do, how do you do it? And once this 5 minutes a day is set up and it's happening, you know, parents say, gosh, I didn't think 5 minutes would be long enough to make a difference, and it is.
And the reality is, you spend 5 minutes playing with a puzzle or colouring in, whatever, it naturally gets longer than that, because it's actually fun and it's okay, and it's a good thing to do, and 5 minutes will be gone, and then you just want to keep going.
And you just give yourself permission. Don't feel like you have to say clever things, or you know, give yourself permission to just sit back and enjoy your child. And just if something occurs to you that you can praise, that's about your child, you're really careful with that puzzle. Or I love how thoughtful you were with the dolls. If things occur to you, then great. If your child says something, you might even just want to echo back to them what they've said. So they might say, I'm going to put the doll over here and she's going to do this. You can just echo, oh, you're going to put the doll over there and you're going to do that. Give yourself permission to sit back and be led by your child for that dedicated period of time.
And how encouraging that something so simple and achievable is part of therapeutic treatment, as you're saying. It's good. Time with our children is good. So we've got a few minutes left, and another issue that has come up in conversation recently is the communication issues with little children. I've heard concerns about a child who doesn't seem to have any friends, seems to be more of a solo player at kindy. Then there's the imaginary friends issue comes in. These sort of social issues, what do you think about? They can be worrying for parents, let's be honest. It's really hard to see your child not hugely social in kindy situations or whatever. What is some of your encouragement there?
Yeah, so absolutely. So it's really, really common for young children to take quite some time to find their feet. And at the risk of generalising, you know, oftentimes that's harder for boys too.
Right.
As you know, they tend to sort of flutter, and girls then have their own set of dynamics with kind of, you know, relationship difficulty. I mean, I guess what I'm saying is it's really common for children to struggle socially. And I'd encourage people to see that struggle in the broader context of the child's development. So if your child's developing really typically across the board, and you've just got some sort of issues with social development that are sort of they've just popped up, and they, you know, chances are they're going to settle. Chances are you're absolutely fine. And imaginary friends are common. They're not necessarily cause for concern.
No.
I guess with any kinds of concerns that you have, I'd think about what impact does this have on your child's everyday life. And if imaginary friends or friendship difficulties are starting to have a really profound impact on their everyday life, if they're starting to not go to kindy or absolutely refuse to leave the house, or these real extremes, then you'd probably pop along to your GP and just have a discussion about that. But actually, imaginary friends and social kind of friendship issues in the preschool years especially are really, really common.
Just seen something that did come in. RE playtime, and that going back to that one-on-one time we were talking about before. I've just had a question come in. What if the child can't think of anything to do in that time?
Good question. And so, as I say, one option is to just join them when they're already playing something. Another option is, it sounds funny, but you can just what we call reflect their indecision. So your child might be sitting in front of several toys and just absolutely at a loss, and you can say, you're looking at the toys, you're not too sure what you want to do, and chances are when you start to provide that sort of commentary about what the child's doing, they might say out loud, yeah, because that one's boring and I like that one, and then you can actually just reflect what they're saying. You're not going to choose that one because that one's boring, and you're quite interested in that one. Do you see how easy it can be? You can actually just reflect back to your child their decision-making process, rather than, come on, quick, we've started our 5 minutes,
the timer is on,
hurry up, pick a toy, and then it becomes a really horrible time, and it's not fun for anyone. So you can just sit back and give your child permission to take some time to choose. You're thinking about that. You're looking hard at the Barbie, and now you're looking at the Lego. At first, of course, your child is going to say, why are you talking funny, mummy? Why are you using that? And then very quickly they will come to love it. And usually in the programs that we deliver, we have kids saying, why aren't you saying that stuff you normally say? They come to love it. And then they start to say that to the other people in their life too. It's really powerful.
And of course, you don't have to do anything. You could just sit outside and look at the clouds.
You could just rub your child's back. You could just stroke their hair. You
Yeah.
could just ask if they want to have a hug.
Because some children are going to be more active than others, and others would appreciate that
Absolutely.
downtime moment. Yeah. Oh, we've looks like we've run out of time again, but we literally could talk all day, Melanie and I, about these fascinating issues relating to children's behaviour and our parenting of our children. But just such great take-home points today, really, is that quality time, that connection time is so powerful for helping our children get through any issues they're facing, really, if that helps. So we hope that helps people out there today. Thank you for joining us, Dr. Melanie. So good to have you with us. And thank you for joining us on Friday Live today at OHbaby. Just a reminder, over on Instagram, jump over to Instagram and grab yourself a chance to win what we're giving away on Free Stuff Friday. There's always a little treat there on Instagram on a Friday, so go and check that out. And we'll be back here for Friday Live next time. Have a great afternoon.